Hello, hello. We apologize for the delay. We were having technical difficulties. Apparently there were sunspots, and you know how those go. So we are here. We apologize. Thank you, thank you. Hopefully you didn't go too far. Well, as always, we like to give it a couple minutes just to fill the room a little bit. So please say hello and let us know where you're saying hello from. We always like to give you a shout out. We have a very special panel this evening, volume 1 of 2 volumes, which means there'll be a second town hall next week, same time, same people. We're very excited. So yes, please say hello. Please let us know where you're from, and we'll start momentarily. This is where I pretend to be busy, like, important things. Let's find out how we're doing. We are live. Sorry for the delay. Yes, we are live. We are here. Hi. Hope everyone is well. Please say hello. Oh, Dennis. Hi, Dennis. It's good to see you. Oh, there we are. Hi, Carlo from Rhode Island.
Oh, different.
They'll start pouring in now. Please, we have sushi at the bar. Feel free to grab. It is fresh. Neek from Houston, Texas, home of George Floyd. I was actually born in Houston as well. Stacy Hirschman is here. Hello, Stacy. Hello, Shelly. Hello, Caitlin. Hope everyone is doing well. It's a really pretty name, Neek. Nicque. I've never seen that. It's very lovely. We'll start in just another 30 seconds. So please say hello. Let us know where you're from. And we will get started shortly. And, oh, Caitlin. We have another Caitlin right next to Caitlin. That's exciting. Huh? 2 Caitlins, best friends. Hold on. Let me close my email because I'm getting emails, and it's very distracting. Angie in Norman Park, Georgia. Where's Norman Park? Thanks, folks, for doing the session. You're very welcome, Dennis. Dennis is a board member on the IOCDF and a dear friend of the foundations. And we're actually mortal enemies. We don't get along well. But we do have mutual respect for each other. Okay, here we go. Peter from Boston, and Neek is short for Monique. Okay, very lovely. Caitlin in Long Island. How we both sell it the same way. Okay, Indiana. All right, let's get started. So quickly, this is the Town Hall on Grief and Loss, Volume 1. My name is Ethan. I'm ambassador for the International OCD Foundation, which simply means I have OCD, and I like to talk about it, like obviously way too much at this point. Weekly, in fact, multiple times a week. Yay. So we're really excited to have you here. There's a major war going on between the 2 Caitlins because they both spell their name exactly the same. It must be pretty embarrassing to show up at the same party with the same name, right? Is that like oh my God, you wore the same outfit. That's really embarrassing. Hey, Thomas. So let's get rid of let's go through some quick housekeeping, and then let's get into it because we are coming to you a little behind. We will make up the time for you, I promise. So this town hall is intended to serve as educational content and is not intended to replace therapy. For treatment-related questions, please be sure to work with your local provider and contact a local clinician. The International OCD Foundation is not a crisis hotline. It should not be used if you are in distress or feel unsafe. If you are in a crisis or ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the suicide prevention hotline at 800-273-8255. Also, as always, we want to be respectful and kind of everyone in the room. We try to create as safe a space as possible. It is important to note this is public on Facebook and YouTube. It is being recorded so people can watch the replay for all time. So we always like to keep that in mind if you ask very personal questions. But again, regardless of the fact that it's public, we try to be very respectable and very kind and respectful to everyone. But thank you so much for joining us. So tonight we'll be paying special attention to grieving the past. We have a really special panel for you this evening. I'll get to introductions, and then we'll dive right in. And also, there, as always, there will be a Q&A. So if you have questions, go ahead and load them into the comment thread, and we will get to them probably in a half hour or so. Although always feel free to comment, and if I can work it in, we surely will. So let's start, ladies first. Let's start just to my bottom. We have a new friend, Reverend Angelika Zollfrank. Is that correct?
Yes.
I probably should have run that by you beforehand. Is joined. She has joined the Spirituality and Mental Health Program. She had joined the Spiritual and Mental Health Program at McLean Hospital in 2019 as chaplain and certified educator. She trained as a clinical pastoral educator and served as chaplain at Yale New Haven Hospital in New Haven, Connecticut, and directed the clinical pastoral education program at Massachusetts General Hospital for 10 years before serving as manager for spiritual care at Yale New Haven Hospital. She's a board-certified chaplain in the Association of Professional Chaplains, is endorsed for chaplaincy by the ELCA, and is a certified educator with the Association of Clinical Pastoral Education. She is also a certified healthcare ethics consultant and is published in the area of spirituality, health, clinical pastoral education, and medical ethics. In the aftermath of 9/11, she volunteered as chaplain with the Red Cross for several weekends. Thank you so much for being here, Angelika.
Thank you for having me.
Absolutely. Clearly you're certified, so this is great. I'm very excited.
Certifiable, maybe.
Yes, right, exactly. And I did left that. It was interesting. I left it out because it was too long, but you are from Germany originally, is that correct?
Yes, I am.
And you came over in 2000, so how wonderful.
That's right.
Next, we have a familiar face to the town hall. We have Miss Kimberly Quinlan. Kimberly's a licensed marriage and family therapist in the state of California and the founder of cbtschool.com, an online psychoeducational platform that provides online courses for those with OCD and body-focused repetitive behaviors, or BFRBs, who do not have access to mental health care. Kimberly is also the host of Your Anxiety Toolkit podcast aimed at providing mindfulness-based tools for anxiety, depression, and BFRBs. You may also know her from Instagram, where she has billions of followers and is adored and loved by all. It's a true story. I don't lie. So thank you, Kim, for being here.
Thank you for having me. I love being here.
I'm glad. We love having you. And last but certainly not least, we're very excited to have Dr. Dennis Tirch. Dr. Tirch is the founder of the Center for Compassion-Focused Therapy in New York City, president of the Association for Contextual Behavioral Science, president of the Compassionate Mind Foundation North America, and associate clinical professor at Icahn Medical School at Mount Sinai. Dr. Tirch is the author of 6 books, numerous chapters and peer-reviewed articles concerning mindfulness, acceptance and compassion in psychotherapy and life. Dr. Tirch regularly trains CFT and ACT, acceptance commitment therapy, globally. Dr. Tirch is a Zen Dharma holder, teacher of Buddhist psychology, and Kirtan blues guitarist. So thank you, Dr. Tirch, for being here.
Thank you. It's great to be here.
We're very excited. So we have a really exciting and well-versed group of individuals to talk about. Honestly, this lesser known conversation, not only in the OCD community, but in the mental health community, not lesser known for Angelika, who this is sort of maybe a bit of her bread and butter, but regardless, this is a very topical convo. Wow, I sound very LA when I sound that. A very topical convo. That's a very topical for, okay, Dennis is cool with that. Excellent. Especially for all that's going on right now. And so I don't think that you need to suffer with a mental disorder, a mental health condition, to benefit from the things that we'll be discussing today. So please invite friends or family. We'll be having 2 parts, as I said, and discussing on all things grief and loss. Kimberly, somebody mentioned that, Deanna mentioned that your voice always relaxes her. So it actually gives me anxiety. So we clearly have different feelings. So I came up with a few, will there be an available transcript I can get by email after the session over, including comments for others? There will not be a transcript, but this will be replayable anytime you want to watch it, Angie. So I thought I'd start with a couple questions just of my own design, and then we can sort of dive in. So as I said tonight, we're sort of going to focus on and pay special attention to grieving the past. Obviously, in sort of in a verbatim sort of way, grieving the past sounds like what it is, things that we lost in the past and how are we grieving those things. I think when I think of grief and loss, when I initially hear those words, first thing that comes to mind is people, friends, strangers, loved ones, or even animals, pretty much living beings. But really, anyone can grieve a variety of things from circumstances to jobs to positions to lifestyles to friendships and things like that. And I'll start with you, Angelika. Can you speak a little more to this idea of grief and loss, sort of beyond the traditional sense of what we think of when we think of grief and loss?
Sure. Yeah, I mean, if you think about it, we live our entire lives with this idea that we should accumulate and add to our lives, right? And whether it might be material things or certifications, or whether it's something that we do, experiences, travel, building a house, having family, all these things are added to our lives. And we talk about those things a lot. But then at the same time, we actually lose something every single day. And you could start to write that down for yourself. What are you losing every single day? Are you losing a tooth? Are you losing a friend? Are you losing a job? Are you losing a relationship? Maybe you have just lost a pet. Maybe you lost a plant that was dear to you. We lose something every single day. And we're usually a little bit aware of it or not so aware of. I mean, it could be your favorite cup that you drop on the kitchen floor, right? So it could be anything. And it's just this moment of, oh, that hurt. And then it depends on how big a loss it is, where we actually have to grieve. And as human beings, we so want to avoid suffering. We so want to avoid those feelings of loss. And when it happens, and we want to go back to the way things were, then we actually add more to our suffering. Because now we're not only grieving what we lost, we're also trying to recreate something that's really irrevocable and irreplaceable. So it's a tricky dynamic, this idea of loss. And Americans are not so good at dealing with grief. Really, we don't like to do it so much. We like to travel and move into busyness and work and, try all kinds of things to avoid those feelings, but we actually can't. It's part of any human life.
A follow-up, and I don't want to ignore Dennis and Kim, but a follow-up, Angelika, is the grief and loss we experience from a teacup the same grief and loss that we experience from a loved one or a son or daughter, just magnified by importance and emotion and attachment?
Well, maybe it's just simply magnified, but that makes it very, very different. There is a way in which we might even think about the loss of a loved one as an existential loss, right? We are losing someone we actually cannot bear to lose. You might find that you've said to someone, I can't imagine a world without you in it. And that's a kind of existential loss. We can't bear it. We feel we cannot survive it. And the world is so different after we lose someone who has been incredibly important to us as a life partner, or, it's just those times are very, very difficult, and it takes time and energy to move through the stages of grief and through the ups and downs of grief. And we need time, energy, friends, connections, spiritual practices can help. So those are very important ways of observing losses that we all experience the longer we are alive.
Thank you, Angelika. I'm looking forward to talking. I think we have a beautiful balance here with Dennis and Kimberly, and then you, where we have this interesting invisible line where it goes from healthy grief and loss to, at least for individuals with OCD, where it can become compulsive to overly focus on this and try to move forward. So I think it'd be interesting to find this balance between when it's okay to go through the stages of grief and loss, and it is of course always okay to go through those stages, but when it can become compulsive and sort of when that shift happens, because I think, right, it's a balance for dealing with all of this. So I know I'm already seeing some questions sort of diving into that gray area. Dr. Tirch, so I'm curious how grief and loss relate to sadness and depression. When we notice profound change in our lives, like COVID-19, for instance, we're sort of quick to notice other emotions: anger, frustration, sadness, annoyance, and the grieving the loss of familiarity. Familiarity is not something that comes to mind. How are those things interrelated?
When I think about grief, as with other emotions, really, I tend to think about the function of those emotions, and the function of those emotions in an individual life and an individual learning history, but also for this species, for this one, life form and the part of the evolutionary flow of life on the planet. I think there's wisdom that we can gain by dropping in to that kind of awareness and considering, why would it be that we would be pained by loss and grief, particularly of others? What is it that is happening to us? I think David Sloan Wilson calls this kind of thinking, looking at when we're dancing with ghosts. What is our evolutionary history that informs this? We need one another, this species, to make a very long story, a little bit short. We depend upon one another. There's the wonderful adage in evolutionary psychology that a lone monkey is a dead monkey, and human beings, it's even more to the point. We are a cooperative, caring, affiliative species, and we need one another for survival. So our brains have evolved to be hardwired to protect and safeguard our relatedness. We function at our best when we feel loving and feel loved, and our connections and our attachments help us regulate our hardwired fear of death, destruction, isolation, all these things, So sadness, in a way, relates to our motivational systems and whether we feel it's worth doing anything at all. But sadness also relates to whether we feel emotionally safe. And loss, attachment loss, separation, all of these things that can evoke sadness and grief are intimately connected to motives for our survival as a species. And so when we experience what we call depression, it's not so much just being sad, and it's not so much just losing pleasure in daily activities. It's that some experience within us has caused us to shut down in the face of overwhelming social threat or overwhelming grief and loss. We feel so existentially threatened that we downregulate our ability to even feel motivated, and we begin to shut down. We move into a submissive state of what, in the late 80s, a mentor of mine, Paul Gilbert, described as a powerlessness, in his book, Depression, The Evolution of Powerlessness. So when we encounter our grief and loss and attachment anxiety, as we do during difficult times like this pandemic, we're really coming into an intimate contact with some of the most foundational emotional experiences that define us and make us human beings. And there's great wisdom and transformation to be had in that encounter.
Wow, there's a lot to process there. That's really profound, and I'm going to continue processing because I have a few follow-up questions.
Cool.
Actually, I'm gonna actually come back to you, Dr. Tirch, for 1 second. We've had a few acceptance commitment therapy panels. I'm a huge proponent of ACT. I know we all here are. It was very impactful in my own treatment and therapy. for those of the viewers that don't necessarily know what acceptance commitment therapy is, quickly, would you mind defining what ACT is, and then going so far as to say why ACT is beneficial in dealing with things like loss and grief?
You know, acceptance and commitment therapy is an extension of the cognitive and behavioral tradition, if you will, the scientific discussion involving evidence-based psychotherapies. And it returns to some fundamental behavioral principles, and it expands the tradition to move into areas such as mindfulness, self-compassion, and a concept called psychological flexibility. The underlying idea behind ACT is to train our minds to be able to contain difficult mental and emotional experiences while persisting and committing to pursue the things that matter most to us in life. So that the purpose of treatment is no longer the cessation of symptoms, but living a life of meaning, purpose, and vitality, and flourishing, really. So it's in many ways just an extension of all of the evidence-based psychotherapy traditions, and ACT and its sort of, you know, a related therapy that we work with a lot, compassion-focused therapy, have an emphasis on evolution and human interconnectedness, and you know, dealing with things like grief becomes central in those kinds of therapies.
Thank you, Dennis. If you're just joining us, this is Grief and Loss. Please feel free to ask questions. If you've already asked a question, ask another question. We'll be getting Q&A shortly. So thank you for joining us. I appreciate it. Kim, talk to us about. You're a bit of a self-compassion guru. So we've talked about, you know, Angelika's perspective and Dennis's perspective. How does self-compassion play a role in dealing with grief and loss?
Right. Well, thank you. I actually would consider Dennis the self-compassion guru above myself.
He's literally above yourself.
I think it's so important when it comes to looking at grief. And the most common thing that I see in my practice is people feeling ashamed of feeling grief. I think we have learnt to believe that grief is something you should only feel if you've lost like a direct family member. And then beyond that, I think not specifically for everyone, but many times I have people who present to my office saying, you know, I shouldn't be feeling grief. This is you know, what's wrong with me? You know, what is this about? Am I weak? Am I being dramatic? And all of this. And I think that compassion, particularly looking at how much it is, as we've said before, such a human experience. When we're looking through the lens of compassion, as Dennis said, we're wired to be compassionate, but everybody grieves, right? Everybody grieves. And I think what we tend to do is we think if it's a loved one in our family, we think we're allowed to grieve up here. But if it's a teacup, we don't think we should be allowed to grieve. And the compassion piece does give us permission and an environment internally to allow that grief to flow through us, grief that isn't grieved can get stuck, right? And can show up in the form of depression and many other ways, anxiety as well. And so if we can open and be kind to ourselves while we experience grief and work through grief, it tends to be a less traumatic experience, and it tends to be an experience that we can feel a sense of mastery over.
Well said. Thank you. We'll get to your questions momentarily. So Angelika, you brought up some great points, and I don't know if they're in front of you, they're in front of me, so I'm gonna read some of the stuff that we previously talked about, because I think it's important. I'm sure a lot of people that are watching are experiencing at least some of these things and didn't necessarily, I don't want to assume, but perhaps didn't recognize them as grief. So you wrote, the discomfort you are feeling is grief. So you just listed a few things. COVID-19, something bad is happening, but we can't see it. Obituaries, 23 pages in the Boston Globe, New York Times on Memorial Day weekend. Loss of jobs. Over 33 million Americans lost their job, income, role in the family, meaning, purpose. Loss of social connections, physical distancing, transitioning rituals, graduations, weddings, funerals. Loss of habits and places, work, gym, coffee shops. I guess routine is another way to word that. Loss of assumptions and securities, loss of trust in our systems, sympathetic to losses of others, feeling overwhelming sense of compassion for friends and family. And losses in general we are experiencing are in many ways too much to comprehend. I'm curious, in terms of, what am I curious about? I think that saying that the discomfort you are feeling is grief, from a clinical perspective, we've done so many town halls on so many of these conversations, and a few times, like Kim and some other clinicians have mentioned, this is grief that you're feeling. But we always, a lot of times, and I guess Kim can correct me if I'm wrong, because she's been in a lot of these, we look at these in terms of you're feeling anxiety. We do use discomfort. Discomfort is anxiety, but we look at them in psychological terms. And you've simply simplified this as, no, you're experiencing grief from these things, from a spiritual perspective, and not necessarily a psychological perspective. What are you talking about here?
Well, it's interesting, right? We're living in such a world of psychological language that it's easier for people to say, I'm feeling anxious, I'm depressed, but it's harder for people to say, I am grieving. And, it's amazing because this is actually a collective experience right now. So it's not just that someone is grieving the death of a loved one, which, there's always a subgroup of people who are grieving the death of a loved one. But right now, it's 100,000 people in America and more, right? So we're constantly actually surrounded by this sea of grief. Yeah, you can put it in psychological terms and say, well, we're adapting to a new reality. We're working from home. That was, for example, one of those times where I think people were grieving. All of a sudden, you couldn't go to work anymore. It's a huge change. So the way I think about a change is that there's grief that comes with it. And spiritual and religious traditions have, for centuries, prior to any psychological framework, have dealt with those changes by inventing spiritual practices, by finding words that people could repeat in times of change, by habitual practices and prayers, spiritual or religious scriptures that people go to that have been around for centuries, right? So you could say, and they're tried and true. They have been around for a long time. They wouldn't be if they wouldn't help people in times like that. So those experiences of grief can feel extremely isolating, and they can feel like they're too much. And certainly with COVID-19, what is traumatic is that it feels like a too muchness of grief. And so then it's very helpful for people to be able to put their own grief into the meta context of a meta story of a religious system, or a meta context of a spiritual practice that's been around for centuries that one can re-enter into. And of course, also spiritual communities play a role here. You could also water it down or generalize it and say, well, it's a spiritual practice for some people to create a watercoloring every day and to express themselves in this way. It's a spiritual practice for some people to do a 15-minute journal entry every day. Others don't call it that. They call it a psychological tool, right? But I think we need to be open to that wide experience of spirituality that people have, because often in the clinical context, people feel that they can't speak of their spiritual or religious lives because they know that the clinicians who are training them don't necessarily share those beliefs, and therefore feel a great deal of actually stigma around spiritual and religious practices. So it's important to normalize those and allow people to speak about those beliefs, values, practices in a way to help them integrate their spiritual identities into their overall treatment. Sorry, I've been going on for a long time here, but I think it's an opportunity really for us to have this dialogue across, if you will, disciplines, right? Spiritual care, chaplaincy, and psychology, but also to really serve people better and understand ourselves better. Sometimes it may be that a spiritual language, grabs a hold of someone's heart in a different way than a psychological term. And sometimes it's the other way around. We just need to figure out what works best for people and what helps people the most in times like this, where grief is all around us and we need to somehow get through it together.
I love that. And I think you're absolutely right. And I think everybody here agrees with you is that we need to embrace all the tools at our disposal, not one over the other, because they can all be effective. And I sort of look at Dennis as the embodiment of the intersection between spirituality and psychology. In fact, in my head, you are not sitting on a chair, you're currently floating.
Oh, that's great.
Yeah, I know. That's where I'm at. Like, your legs are, and you're floating. Yeah, and I mean, even in your biography, you talk about your Buddhist influences and things like that. For you, where does that intersection lie, and how have you? I don't want to veer too far off of grief and loss, but maybe we can integrate. How have you interwoven spirituality with your own, psychological practices?
Well, I love your sense of humor, Ethan, and the levity and the sort of joyfulness that you bring into these kind of things. It's really appreciated. And I think it's good to like poke holes in things that way and kind of question things and to be playful about things that are very serious, that hold a lot of meaning, death, grief, loss, love, spirituality, psychology. What are the best terms to use? I've found that there are many different languages and many different metaphors that point to ways we can liberate ourselves from suffering. And compassion, the classic definition that sort of involves a sensitivity to the presence of suffering with a willingness and a commitment to do something about it, right? And when that's been adapted from Buddhist psychology and contemplative practice into psychology, we've kind of added together, in our communities, sensitivity to the presence of suffering in self or other, coupled with a commitment to do something about it, to take action to do something about it. And it hit me a few years ago that there's two layers we can address this suffering. One is the layer of addressing suffering, like I see somebody has fallen down and I want to pick them up, I want to help them up, or I see someone has going to cry and I want to give them a hug, or I want to ask what they need. Somebody's hungry and I feed them. That's addressing human suffering, And then there's another order of magnitude of addressing human suffering that many of the contemplative paths and spiritual disciplines talk about, which is returning to an awareness of who we are, of our nature, of our being, and exploring the ways that we as an individual being interact with all being. And for me, there's a question that was about, spirituality and psychology. The term psychology means like the science of understanding the spirit, actually, as well as the mind, So applying the scientific method to questions of mind, spirit, consciousness maybe is in psychological domain. And spirituality is like an experiential, neurophenomenology, like if you will, like Francisco Varela called it, like our own subjective exploration of our relationship to being and non-being. And there are many rich tools to do that. I mean, the definition of mindfulness, which was sort of lost when we adopted the paying attention in the present moment, non-judgmentally and on purpose definition, the definition of mindfulness originally meant remembering to be aware in the present moment of your nature and the nature of reality. Like, come home to who you are, return to your inherent wisdom of knowing who you are. And that is liberation from suffering. And grief is a doorway, a necessary and terrifying doorway to appreciating the nature of being and non-being, the nature of interconnectedness and separateness. It is something that we step into wholeheartedly in the best case scenario, and it allows us a certain kind of transformation. So, that's what I aim to do in my own personal practice and with clients and students. And you could call it anything you like. You could call it psychology or spirituality. We draw on research. We draw on Rig Veda. We draw on Steve Hayes, or tap dancing if we had to. It's about a human transformation, and grief is the most profound teacher standing in that doorway to have us come to terms with who we are.
That's actually, I'm going to make a note, because that gives me grief, because it gives me a question that I want to ask in a bit. And thank you, Dennis, for the very kind words. Yeah, I use a lot of humor, if you know me, because I think you have to, and I try to use it in meaningful and respectful ways. And so thank you for your very kind words, as well as your answer. Clearly your shirt is black and white, but you are not. So we thank you for that. We are, please again, ask questions. I literally have 2 more questions, kind of pulling these out of the hat at the moment. Like the original questions that I had written down is like, what are your name and what did you do yesterday? So we're moving beyond that. But I have one question. Let me ask this question, and then I'm going to ask it to all the panelists, and then I'll ask a question which will segue us into our questions, which is, so, and I know we were talking about grief and loss, not in terms of death. However, in my own life, and I'm sure in many people's lives, we either have friends or are individuals that are parents that have lost children. And from what people have said, and from friends of mine that have experienced that, there is no greater than losing your child, regardless of age or circumstance or whatever it may be. And this has come up in my own life this week with a friend of ours, and so forth. So, and I've seen this in the OCD community, and everybody handles it completely differently. Profoundly differently, exponentially differently in terms of processing and moving forward. I would really like to throw this out to all 3 of you and probably have you each weigh in, which is, obviously there's no right or wrong way, but I'll start with you, Angelika. When you are meeting with somebody who has lost a child for the first time, and maybe subsequent times after that, what does that initial conversation go like? What do you say to them? What should the first year look like? Should it look like a certain way? Is it different for every? Just take me through that process, because I really want to touch on this a little bit.
So yeah, wow. I mean, in some ways, it's a narrower question than the question that we were discussing earlier, which was totally general about grief. But now we're talking about the loss of a child, right? And then I would need to know a little bit more about what kind of a loss of a child, right? It's different whether a woman has a pregnancy loss and a miscarriage, or whether you lose your newborn after a few days, or whether you lose a child at the age of 3 of a terrible brain tumor, or whether you have a child that you've cared for a long time, but a child that has had severe neurological impairment, for example, and you've taken care of that child and every single need of that child every single day for, let's say, 15 years. And now that kid is dying. So, it's all, these are different scenarios. It could be an accident. It could be a suicide. Could be all kinds of losses. So those would be a little bit, that would inform my listening, because it's different whether someone had a time to anticipate a loss, or whether it's a very sudden and traumatic loss, or whether, as in the case of children who are taken care of by their parents or mothers, often 24 hours a day, that there is an identity that has formed around that caregiving identity, and it's impossible to quickly have another identity and move out of that. So those losses can be very, very difficult. So, depending on what it was, I would simply...
Let me specify just for our audience per se. For the most we hear is either loss of a child, teenager, or adult from accidental overdose or suicide. That tends predominantly the people to and the parents that lose their children in that way. So maybe I can hone that in a little bit for you.
Yeah, I think the most important bit that I would do is just to be aware that there would be shock, literally even on a physiological level, upon hearing the news. And then it would take a long time to take in that reality that, my child has actually overdosed, has actually died, is no longer going to just be hospitalized and come back. So that would take a while. And I wouldn't necessarily talk a whole lot, although I'm talking right now a whole lot. I think my main important intervention would be just to be with the person and to try and, in a state of shock, people don't even know that you're there. They have no recollection afterwards. They just go to the ground when they're notified. And someone needs to make sure they're not hurting themselves. But beyond that, you want to just stay and take your every clue from the body language of a person in that moment, and have a very subtle observation of whether the person wants to express something, often not necessarily verbal, and how to help a person express. And then at the same time, you'll see that a person who is so acutely grieving will also pull back into themselves, because the pain is so unbearable that there's a kind of shutting down that happens too. And it goes back and forth, shutting down, coming into reality. And you need to be very, very careful with your observation and almost birth that grieving process with the person. And it's incredibly painful and takes a lot of ability to be present and concentration to really observe. But beyond that, I think in the long run, so that's the acute situation. Then there's usually a lot of like, what do I do now? If there are other children, if there are other family members, there's usually a sense of, wanting to know, where are all the other people in my family? Like, let's take a head count. Where are they? I need to talk to them like now. And it's both being in touch and an anxiety about, is everyone else okay? And then over time, there's a lot of busyness around the actual, whatever funeral plans or laying to rest or grieving that acute phase. And usually that's when people also really are exhausted and just simply need rest. So it's very important to just take the clue from the person who is, or from the people who are in the midst of that experience, and be very loving. You can't be kind enough. And it's very important not to tell people anything. I mean, the worst thing you can say is, oh, you know, they're now in a better place, or, oh, you know, this was all God's plan, or it's happening for a reason. No, none of that. Those are terrible things to say. The best thing to say is simply, I am so sorry. And then be quiet and just sit with the person and observe very carefully what they need. And then there's the other piece, that grief is just incredibly exhausting. So people usually forget to eat and can't eat, but they also forget to drink water. So as practical as it may sound, that those are important things to pay attention to. And, you know, if people are on medications, they need to take those, and just very practical bits and pieces. And then, you know, people will often find some kind of solace in, at least that's what I see as a chaplain, in a prayer, in something that can hold this unbearable moment, you know, to put it into some context. Now my child is gone, so now who takes care of my child? Where's my child? And so, you know, in Christian traditions, there's this idea of the everlasting arms of God. You know, in Buddhism or Hinduism, there's the idea that the soul, or the energy that within a person, the consciousness is actually returning to the bigger consciousness, so it's not lost, right? But this worry that someone could be just lost is a big worry, and that's why it's important to kind of grab a hold of that with a spiritual practice that fits the grieving people, you know, parents or family. I'm going to stop here. I'm sorry. You've taken me back to the emergency department and to people with very acute grief right there.
Sure.
And so, but interrupt me whenever is right.
No. I appreciate what you're saying. Kim looks bored, but I'm interested. There is, and actually our dear friend Dennis, who lost a son, who I mentioned earlier, he wrote, "Don't tiptoe around someone who has lost a child for a fear of stirring up their feelings of sadness, and for fear of reminding them of the loss. We think about it all the time." Mm-hmm. So Kim, let me turn to you and sort of take this to the next level, or not to the next level, but sort of the next series where it's not so acute, and we're sort of, you know, a period of time out, and there's this fight between, you know, as Angelika said, there's this push and pull between like being inside and reality and being inside of reality. But from what I've observed from my friends, like that push and pull continues for quite a while. Mm. And, you know, how do you address sort of, you know, a year out, where you're seeing still, you know, obviously pain, sadness, depression, like how do you coexist? And I know that Zach coexist with that, but still move forward in ways that are valuable to your own life.
Right. You know, I'm not particularly skilled in the spiritual area, but because of my work of treating people with anxiety, often what I find is really helpful for people is to at least be able to anticipate what's going to show up for them, and to sort of have a little bit of structure there. And I always love to share with them the Kubler-Ross stages of grief. Because I think that when we're grieving, everything is the emotional piece is so chaotic and exhausting, as Angelika said, that sometimes it is helpful to sort of know what to expect. And so the stages that was, you know, hypothesized to us of grief the first step is denial, right? I'll just go through them so I can answer your question. The first step is denial. Then people will often move into anger and rage, really trying to like wrap their head around why did this happen? Then they often move into bargaining, right? Trying to bargain, if I only had done this, if I had only, what could I have done to prevent this? And then it often moves into a stage of depression. And that is often what does show up around that year's stage, right? That it's normal to have an experience of depression and hopelessness during this very, very difficult time. Since Kubler-Ross wrote this, David Kessler has added another stage of grief to the grief process. And he talks a lot about making meaning. Making meaning of the grief that you went through. Now, it's really important that we understand here, what we're not saying is, as Angelika said, oh, this happened for a reason, so I'm going, this happened so I could go and do these greater things. The making meaning is how you use this amazing life you had with the person, and you make meaning of the time you had together. It'll never take away the grief that you feel. But many people, particularly in the mental health field, who have suffered a loss of a child due to addiction, overdose, suicide, have found that making meaning of that and the life of their child has been incredibly powerful and incredibly healing. It may be as much as educating other parents on what to look out for with people who have severe depression. It might be creating a fund for people with addiction and so forth. But around the year is where you should expect it. I mean, what I should say here is you can't expect anything, because those stages don't go in that order all the time. They will cycle and they will go all out of whack. And that's okay. That's okay. It's okay for them to not go the way you thought they would or in the order in which I shared them. But through time, if you can, the work can sometimes, it doesn't have to be, this is not something you have to do, but it can sometimes be using that wonderful life and making meaning of the time that you had together.
Thank you, Kim. And I appreciate everyone for listening. I know it veered a little bit off, but I actually know some people. And Dennis, I hope you didn't mind me calling you out publicly, although you're obviously very public and you've started some amazing things for Nathaniel. But I know a few people that are watching that have lost children, so I thought this conversation might be beneficial. I'm going to actually go ahead and carry this into some Q&A. We will go, if it's okay with the three of you, maybe we'll go till 8:40 instead of 8:30, since we started 10 minutes later, if that works. If not, no problem. You'll just be, hated for most of your life afterwards, but it's fine. Nobody will fight you. Our dear friend Pavitt, I'm going to throw this to Dennis. This touches on obviously what we're talking about right now, loss of a child, but can also touch on a variety of other losses. So Fran Pavitt at 7:20 p.m. asks, how do you avoid dwelling on the loss for too long or becoming a victim due to the loss? I think that's such a great question, sort of that, how long is too long to I don't need to. Go ahead. I bloviate sometimes. Don't mind me.
No. You don't. You're perfect just the way you are, Ethan. Don't even.
That's what my mom says.
I mean,
I'm the only one.
She's right. It's her job to tell you that. That's good. It's good. I want to circle back to one small point.
Mm-hmm.
When I mentioned earlier that grief is this teacher, I think it's really important to respect the depth and reluctance we have to experience grief. Like, I have a daughter who is 14 months old, and I actually had a thought before we did this, and the thought was, man, I hope we don't talk about the death of a child. And I'm like, acceptance and embracing these things and all this. And so when you mentioned that, I thought, oh God, man, here it is, but that's cool because we're going right into it. A very dear friend of mine, Martin Brock, who does some ACT and grief workshops on losing a child, began doing that after his daughter died at age 18, and being close to his process as well as that of several clients who've lost children, was life-changing, and what I've learned from my clients and from Martin and from another colleague who's a priest in the Zen tradition named Joanne Cacciatore, who is a psychologist who wrote the book Bearing the Unbearable, does work with grief and child loss. One of the things I've learned is we're talking about a relationship. We're talking about a lifelong relationship, a relationship between you and a person who now is not present as a physical entity, but is present in your mind and in your heart. And whatever that might imply to people in spiritual traditions, or even just as a part of you, as part of your interiority, as part of your experience. And there are no limits or guidelines that I know of as to when and how someone should get over or let go. I think fully embracing and exploring with great compassion and awareness these experiences is where the transformation is, much more than moving past something on any level, really. So when Angelika earlier was mentioning like the shutdown response that people have, well, that's a biologically and embodied dissociative response to something that could be overwhelming for the organism. One last thing I want to mention, I'll kick it back to everybody, is like when I learned about how much people are afraid of sadness and grief, it's actually research points to that being the emotion that people are most prone to be afraid of or avoid. And the theory is twofold. One is that when you're crying, your eyes are filled with tears, you lose muscle tone, you lose your ability to be alert, you experience yourself as physically vulnerable. So we're physiologically defended against being overwhelmed with grief in a way that we are not in some ways against other emotions. Anger, we're ready to be angry because when we're angry, we're even more able to defend ourselves than when we're not angry. But grief, shut down, slow down, there's a lot of hardwired inherent avoidance around that experience. And human beings lacrimate and cry in the context of social safeness. It is probably an attachment signal for shared parenting early in human and primate development. So something very, very important happens when we're opening to the experience of grief and allowing ourselves to cry and experience loss in the context of a safe emotional relationship. We're at our most vulnerable, literally, physically, spiritually. We're opening ourselves to something like that we really are reluctant to open ourselves to. And it's essential to allow that process to be and to create a safe container for that process to proceed, rather than to jury rig or figure out or cognitively restructuring or do a lot of fancy dancing. We're creating a context of mindfulness, compassion, acceptance, and healing with our clients so that their relationship to those that they've lost can proceed and evolve. That's the way I've tended to think of it.
So when you say it's a process, why do some people get stuck at different parts of the process? And in other times, why do people, I guess, either consciously or subconsciously allow grief to be the teacher and move forward in productive and proactive ways with, at the same time, feeling whatever they need to feel and respecting what's happened?
Well, if Kimberly or Angelika answer to that question, that might be a way to pivot, because I know that you must have so much wisdom to share around this. Would you want to take a crack at that as a pivot, or should I just give a brief answer?
Well,
go ahead. Yes.
Yeah.
I mean, I have mainly really stories in my mind of people who. So first of all, let me just say, I totally agree with Dennis, right? There's no like expiration date on grief. There's an expiration date on every single human body. And our spiritual traditions say you are more than that expiration date, okay? But grief itself, if you are losing a child, how would it ever in some ways end? You are a changed person. You would always be a changed person. And people who lose children will always say, now he or she would be 21. Now he or she would be, all the markers of what the life that cannot be lived. And it's painful all their lives, including up to, and I've seen this too, where people are elderly and sitting in a hospital room and they say, well, I had a child, and there's that anger again, but he's no longer around. And so it comes up all the time, because that relationship with the person who died will never go away. Or sometimes people will say, I wish I could share that with my, Peter, Timmy, whatever. So I wish I could share that. And it's not it, and at the same time, well, how can you? What do you believe about where that person is now? And this renegotiated relationship with, and that's what we're talking about, right? So as long as grief is really a total shutdown, stuckness, I think there is help needed. But as long as a relationship can be renegotiated such that it doesn't end, it never ends, but can be, life-giving for a person, rather than deadening, suffocating, or just like imprisoning. That would be sort of how I would listen to it. So that I have a person at the church that I attend, whose child committed suicide, and I always ask her, every time I see her, I say to her, how are you doing? And she knows that I'm not just asking, what was your week like? But I'm asking, what was this week like, grieving your son's death, which is like several years back. And she always talks to me about it and is relieved when other people can talk about it. So this idea of, now it needs to be over, let's not talk about it. I think for people who are accompanying others, it's very key that we keep asking, keep checking in. And because for parents, that person lived, and there's a new relationship in some ways there, and it's not gone.
I love that, Angelika. Kim, so to carry that on and actually to come back to Pete's question, how do you avoid dwelling on the loss for too long or becoming a victim due to the loss? If you've seen a client for 1 year, 2 years, 3 years, and they're really still struggling to I don't want to say move forward, but to start living again, respecting the process and their own natural process, but at the same time, move them forward in an organic way. How do you approach that? What do you do?
Right. So what I would first bring up here, just to speak off Angelika, is I have some dear friends who have lost children, but also some dear friends who have lost a parent, right? And I think what's interesting about this is when you lose someone you love, you join a club that you didn't know existed. They'll say, I had no idea there was a club called the, I lost my mom club, or I'm one of my children. Like, what I'm saying? You become a part of a community that you didn't know existed. And that can be very triggering to your own identity, because you didn't have time to prepare for that. And that can be a huge piece of the work, right? But to speak directly to what you were saying, I'll tell you a story without giving any identification. Is a client of mine who was very much struggling after a year with grief and very much stuck. And they posed to me, this person of course had done their research, that grief under the diagnostic manual is a 3-month process. And she was incredibly outraged by this because she said, am I supposed to be done? And this was a very, very difficult process for her to see that the diagnostic manual had sort of said you're 3 months and you're done. I think it's a really important from there, if you are struggling, is to first recognize that that book is only there to help us get correct treatment, right? The DSM, it doesn't actually mean grief is supposed to last for, 90 days. If you are stuck in grief, and I'd be really curious to hear what Dennis has to say, but a lot of the work I do is while they grieve, not instead of, but while they grieve, they still connect to the things that they value dearly, right? They engage in the things that still matter to them, even if that means watching a show that you enjoy, even if it's very, very small. It could be creating, like I know in the notes, Jeff had said, like Riley's wish. It could be creating a full foundation, but it also could just be making yourself dinner. And if one of your values is to take care of yourself, start there, right? And so, I think if we can break it down into small mini bites, sometimes that can feel more doable. Because when grief is there, everything feels undoable.
Dennis, do you want to add to what you were saying? You're on mute, Dennis.
Thank you. Much in what Kimberly and Angelika are saying that is really hitting home. One element of what Kimberly mentioned, which I find very important actually, is acknowledging that there's no form of grief that is particularly privileged. Like, of course, the loss of a child, it hits like home in a very profound, I said that word so many times today, but like a big way. It's and for those people who lose a child, it is, I think, particularly heavy and life-changing. And my heart is with my clients who go through that, and my friends and colleagues and family members. And then there are people who lose parents when they are children, like the motherless daughters movement. There are people who lose spouses. As Angelika said, we're all losing. That's the nature of life, is to be a part of this process of impermanence and loss and sadness and grief. I have a friend who had a stroke when she was 40, and I was helping her up in this ridiculous stone stairs I had in this lake house, and she was having such a hard time, and she said, you should put her in a ramp. I said, oh, that would be wonderful, because when you visit, she goes, no. Everybody's temporarily able-bodied. It's not just for me, it's for all of us. And everyone is, if you are not currently grieving, you just don't know that your membership card's in the mail. It's gonna happen. And the illusion that the mind plays on us is that in order to live our lives, we need to get rid of the bad emotions. And the trick is that in order to live our lives, we need to live our lives. And if we can create a containing platform that allows us to fully experience the range of our emotions and allow our mental events to be what they are, not what they say they are, and to kind of see through all of the sort of shadow puppetry that our mind puts on that tells us we have to do this, we have to do that, then we can really feel our feelings in a context of loving kindness and acceptance, and use our hands and our feet to live our lives. So I'm not interested in someone getting over anything, including anxiety about hand washing or feeling depressed or grieving someone, in order for them to live their lives. I'm interested in walking beside them as they live their lives as deeply and as richly as possible, carrying all of that with them, because that's, to me, where the magic happens. And I've seen it in my own life. I've seen it in the lives of my clients and my loved ones. And that's sort of, to me, just the most important thing I can contribute to while I'm here, before I'm somebody else's grief.
I love that. Angelika, do you have thoughts as well?
I was just listening to Dennis and really loved what you said. I think about it in very much similar ways. And, I love the idea that the membership card is in the mail. Thank you for that. I have plenty of membership cards already. I guess I collect them over the years. And it's, I think it's so, I'm going to say something really old worldish and old fashioned, but maybe you can give me a moment of indulgence here. I think that one of the difficulties is really too that we don't have a whole lot of experience of suffering or grief anymore as we grow up, right? I mean, we all have vaccines, so we don't get sick very much as kids. People die in the hospital. We're geographically separated. A lot has changed. COVID-19 makes it impossible to be with our loved ones while they die. And, when you actually have experience of observing someone die, then it's much less terrifying and much less terrifying to grieve. So that whole avoidance thing makes it actually harder to grieve, and to be around death more is making it more possible. So in some ways, the spiritual and religious traditions are very much also into this memento mori. Remember that you will die, and that became a spiritual practice, and it's in all kinds of ways. There's a Buddhist group that basically meditates on images of at times violently killed people and makes that the spiritual practice. So it's being around it that makes it possible to not be quite so scared, and that's the kind of help maybe that we all need, because maybe our entire society is a little OCD, and maybe we all need a little desensitization. And when we actually talk about our losses and about our grief and talk about what it's like, then someone who goes through it doesn't all of a sudden feel like they're odd and they need to label themselves with a diagnosis. That's what I would say as the chaplain. And I agree also that, of course, the big question is always, does life move on in some ways after, a loss like that? But then at the same time, who am I to say how it should move on, right? I can't say that. I would never say, that it's, I mean, I had a person who told me she goes to her daughter's grave every month on the day that her daughter died. Now, then it became, she had to take that day off, and then it became a problem with work, right? And so then we're talking about another problem. But really, is there anything wrong with it? I don't know, right? So.
Thank you, Angelika. It's interesting because I've been doing so many of these town halls from a psychological perspective, and so my brain is currently trained around all these modalities of psychological treatment. And I was listening to Angelika speak, and I'm sure Kim and Dennis might relate. And like the immediate two things I thought of was anticipatory anxiety and habituation, because it's like essentially, and I don't know if that's accurate or not, but when you were talking about this avoidance factor of being around people who die. And like, I know that I've never seen anybody die. And when people close to me died, I sort of, saw them. I didn't want to remember them that way. That was the excuse. So I wasn't with my grandmother when she passed or anything like that. And to this day, that really scares me to see that. But again, I would imagine that the more you're around it and respect it, the less scary it gets, which is in a sense, habituation to some extent. So I don't know if that's accurate, but just from a psychological perspective, that's what that sounds like.
Absolutely. And I'm sorry, I'm really passionate about this one, because I think we do need elders who, or companions, friends, folks who are with us and who say, I'm going to go with you to the funeral home when you pick out the casket and when you talk to, people and make those decisions. And just to like you know, and people who share, all of a sudden, when you have the membership to the club, right, there are elders who will say, hey, this is what we did. Let me do this and let me go with you. But you know, right now in COVID-19 times, we can't go to the hospital and we actually can't be with our loved ones, which will down the road make it much more difficult because people didn't see that someone died peacefully after all. You know, and what we imagine can sometimes be worse than the reality as well. So I very much agree. It's a good idea to just be around it a little bit more, because grief in and of itself and death in and of itself does not have to be traumatic. It's part of who we are. We make it traumatic because we're not around it.
Yeah, because we're programmed to deny this humanistic experience, which is like, you know, I don't know, deny, avoid. So yeah, sorry, I had an interesting thought, but I forgot what it was. That's not new to me. So, okay, but thank you very much, Angelika. And you can be passionate all day long. I love listening to you speak. And your point of view is really wonderful. I'm actually going to go ahead and jump to some other questions. Kim, I'll throw this at you. Fran, Jennifer Vickery at 7:52 p.m. How do you help people who are experiencing grief or loss about time or opportunities lost to OCD or mental illness? And I can totally relate to this, but I'll let you guys speak on it first.
Yeah, thank you. This is something I'm particularly very passionate about. If I were to reflect over the last 13 weeks of COVID-19, what was really interesting for me was to watch the patterns of my clients who have mostly OCD but of course mental illness, is to see the compound effect of having already a mental illness but not realizing that you were grieving it the whole time until something was brought to your attention that you needed to grieve. And so what I meant by that was, as I spoke a lot with my clients about, like, you're grieving the loss of the life you thought you were going to have, you're grieving the loss of spending time with your family. They would then recognize, oh, I actually have been grieving having a mental illness this whole time too. I just didn't know, right? I didn't realize that that was a part of having a mental illness. And particularly with OCD, of course, as I do exposures, exposure and response prevention, nearly every single one, it has something to do with death in it, right? Somebody, so I think everybody would agree that that's probably their most fear. It's their 10 out of 10. And so to compound that you're grieving a mental illness at the same time can be really, really difficult when it's compiling. I forgot the second part of the question, Ethan. Can you bring it
Fran,
up to
can
me?
you pop that back up? She asked, yeah, there you go.
All right, okay. So the thing to remember here, and this is, again, when it comes to mental illness, I think that we have been taught to believe that it is our fault. That if we've lost an opportunity, if we've missed a party, if we didn't get to that wedding because we were at home doing compulsions or we were so depressed, that was because of an innate weakness that we hold. And one thing that I would really recommend everybody just consider is they never asked for this. They never asked to suffer to the degree in which they suffer when they have obsessive compulsive disorder, depression, any other mental illness. And what that then looks at is this idea of you're allowed to grieve it, but do your very best not to grieve while placing blame on yourself. That's always the first layer that I would work with, because if, of course, you're grieving the things that have been lost, the proms that you didn't get to go to, and as we've talked about in previous town halls, like the sexual experiences that you've had, that were very, very traumatic for you because of an illness. It's important as we move forward not to place blame for that. And to give yourself permission to even just start that grief process without that blame, right? In addition to that, I think the first thing to remember is that you, having OCD, having anxiety, you still deserve to name it as guilt. You don't, so it's not guilt, as grief. Again, often I think people get caught up in not giving themselves permission to grieve because they think that it was their fault. So I'd be curious to hear what everybody else has to say.
I want to touch on this just because I'll speak from a lived experience perspective. You know, I was diagnosed at 17. I was born with OCD. I didn't get the proper treatment till I was 30 years old. So I always tell people my story. I missed my, you know, up to 30 years old, right? And I definitely grieved, not knowing that I was grieving, you know, all that I had quote unquote lost. And so there was definitely a lot of anger for me present in those first 2 or 3 years. I reached a place of wellness and functionality very, very quickly. Well, I should say, if you know my story, the process was long and arduous, but at a certain point, I started getting better exponentially to a place where OCD no longer played a role in my functionality. It doesn't mean I didn't have obsessions or compulsions, but it wasn't making decisions for me. And I reached such a substantial place of wellness that I started to get really angry that I didn't know I was capable of having a serene, joyful life. And the fact that that was now a real thing, then I looked back and went, oh my God, I could have had this all along. And I got really angry and really frustrated and really mad at all that I had lost, and definitely dwelled on it for some time. You know, I started to realize that being angry at what I had lost was okay, you know, not trying to live in the past, not trying to go back. But one thing that really helped me, and I'll just say this, is I think when we have OCD and OCD stole some part of our life from us, when we get better, we tend to have this impossible insight on how life would have gone if we never had OCD. And the reality is we have no clue how it would have gone. I believe that if I didn't have OCD, then I would have had a wonderful elementary and middle school. I would have been popular in high school. I would have gone to sleepaway camp. I would not have dropped out of college. I would have graduated with, you know, at the top of my class in acting and gone out to LA at 18 and been famous by 21 and made 50 movies. And I'd be talking to you now from my summer home in Spain. But the reality is I could have also got hit by a bus when I was 6, lost all my limbs. And that's what's interesting, is we can play this what if and think we have in this insight into this life we could have had, but that's just not reality. We don't know what life we could have had. What I do know is I'm here 10 years later having this conversation with 3 brilliant individuals. I have amazing friends and a phenomenal community, and I get to advocate in amazing ways. And so, you know, I would never take back the life that I had, because it's put me in this position now where I feel like, because I like to say, you know, and Dennis and everybody can respond, like I feel like I can see the Matrix. You go through a life-altering experience, a near-death experience, and you gain insight and perspective into life, and you get these amazing skills and tools like acceptance commitment therapy or DBT, dialectical behavioral therapy, or ERP, and then suddenly you're equipped with all these skills and tools. So I'm super excited about the life that's in front of me. Yes, I'm angry at times at the life that I missed. I think about that maybe my parents will be grandparents. Maybe I'll only have 40 years of marriage as opposed to 80 years of marriage, and that those things upset me. But I also think about the amount of rewarding life that's ahead of me, the amount of substantive quality life that's ahead of me, and I have the ability and potential to live so much life. And that really excites me. So that just helps me. I don't know if anybody else wants to weigh in.
Can I just add one thing, because I think you're the walking definition of this process, which is, I think there's an immense degree of benefit in seeking a community of people who have gone through what you've been through. You know, we were talking before about losing a child, and you know, I love seeing at the OCD conferences the young adult group coming together and talking about throwing themselves their prom because they all missed them. You know, they all agree that that was something that they'd missed. So I think that finding a sense of community so that you know that you're not the only one can be incredibly beneficial.
Absolutely. I wholeheartedly agree. Time for a couple more questions before we wrap up. We're just going to go a little bit over. Dennis, this is at you. Peter Summers at 8:16. Sorry, apologies. Fran, Kate Von Goller at 8:15 p.m. What about anticipatory grief? I'm thinking anxiety OCD for me is partly avoiding coming to terms with all the losses coming. How or much should we grieve losses in advance? We'll actually be talking about this topic next week, but Dennis, if you wouldn't mind taking a crack at it.
I think the rules that are showing up as we all sit with these words are giving themselves away as part of the trap, right? How much should I grieve? What should I do in advance? You know, all these losses, anticipatory grief. This is our mind doing what our mind does. And it's not like we need to judge our minds for doing it. It wants to make it okay. You know, my mind wants to figure out how I can avoid, what I can do. Am I doing it right? Should I be feeling this? Should I not be feeling this? And all of that is the matrix reasserting itself, right, Ethan? I mean, this is like, you know, I'm going to be able to regulate my experience. I'm going to be able to take charge of this. And that results in this kind of cognitive entanglement and responding more and more to symbolic thoughts as if they were real. And we get lost and lost deeper down the rabbit hole, as opposed to like stepping into this place of acceptance of the life that we can lead right now, you know, and the witnessing capacity of mindful awareness helps. The openness of acceptance helps. The emotional safeness that comes with self-compassion can also help. It can settle us so we're not like on super high alert. It reminds me of the last question really briefly, and this is sort of all I really have to say about it. When we were talking about like grief about the loss in the past, well, that's about like what we gave up to our minds, you know, rather than showing up for what was really happening. And showing up for what was really happening is like, I really want to be alive. I really want to be alive for what's really happening for me right now. I want to show up for the present moment. But I'm so sad about the losses I've had. Welcome, welcome, welcome. That is what's happening in this present moment. You are where you are, your feet on the ground. Open your eyes, look around you, and this heart that's heavy with sadness, that's the heart you have. So hold it like gently and kindly and step forward with that heart. Reclaim your life with that kind of compassionate stance. That's my best shot. It doesn't always work, but you know, it's the best shot I have. It's the only one that's ever worked for me, quite frankly.
Thank you, Dennis. I love that. Close it up. I'm going to round off with one more question. Actually, you've asked, I do see your question. I know you have a drug question. Generally, when we don't have a psychiatrist on panel, we don't typically like to answer drug questions, but we'll give some email addresses out. And if you'd like to email, we'll try to get you an answer to that question. I appreciate you asking. Last question, Peter Somars at 8:16 p.m. I'm going to throw this out to Angelika. How do you deal with grief when your belief system holds that the loved one probably didn't go to the good afterlife?
Okay. So big question there at the end, right? But so it's really important to talk about this one because a lot of people struggle with this, particularly around suicide, of course. And, you know, I would want to know what particular belief system that is. So just to say briefly, for the Roman Catholic Church, the teaching was changed. The Catholic Church has stepped back from looking at suicide as a sin that cannot be forgiven and therefore lands people in hell. And there's much more of a compassionate teaching today where it's understood that a person who is, deciding to take their own life is and dies by suicide is not beyond the grace of God. And I think that that's a really important teaching. I mean, that's kind of the spiritual version of the acceptance and commitment therapy, right? If I may translate it in that way. Because it really is all about grace, and so many religious and spiritual systems hold that, you know, through spiritual practices, you can find a way of acceptance and opening to what you think you cannot bear, or you are accepted with anything that you decided to do or that happened to you on the basis of a particular illness or suffering that you've experienced. So in that sense, I would kind of gently look for the love and grace of a higher power or God or a supreme being, and work with the person to find that. And just one more thought about this. I think ultimately for people who are grieving as well as their family members, ultimately the grieving process also requires a kind of forgiveness, not only of self or another person, but of life itself, for that it's rotten, unfair, and sometimes just plainly, in the best clinical language, sucks. And we need to forgive, we need to find forgiveness for that in order to move on. And that includes that actually we need to, in some ways, if you believe in God, you need to forgive God. If you need to, to understand that this life isn't perfect, and we never signed up for one that didn't include suffering. And that's the sad fact. But the good news is that's why we have talks like this, and that's why there's an international OCD foundation, because we actually need each other.
Thank you, Angelika. And I'll actually stick with you one final moment. We're going to wrap up. Any final thoughts for tonight?
Are you asking me?
Yes, ma'am. Sorry.
Oh, any final thoughts for tonight?
Any final thoughts for tonight?
I don't know that I have final thoughts.
They're so final.
Yeah, final. Yeah, I don't know. I just wish everyone a kind of peace that comes when we somehow figure out how to be beyond ourselves and beyond this moment. And all in our different ways, we probably have ways to do that. And that's kind of my wish for everyone.
Thank you, Angelika. Thank you. Kimberly, any final thoughts?
I mean, all I would add is I think that when it comes to grief, we really want it to be, I think someone even mentioned, like, we just want it to be done. And I think if we can, just to give ourselves permission to stay in that messy middle where it doesn't have to look pretty and it doesn't have to look a certain way, if you can give yourself permission to just be in the messy middle for as long as you need, that can sometimes take a little bit of the pressure off you to be performing in this way. We don't need to perform when we're grieving.
Thank you, Kim. Dennis, any final thoughts?
Well, I appreciate this opportunity to reflect together. It's an apt topic for this time as well as for any time. And there's nothing, I looked up over there's this thing from Ram Dass' book, Be Here Now, on the wall. And, he uses the term guru to mean like your sort of higher self or divine presence or observing self. And it says, where there's faith, there's the presence of the guru. He is it all your impurities, all your corruption. There it is, smiling at you through them, saying this too, understanding all of it, total compassion, which means you are everything. You're the universe. And it goes on. And I keep that up there as a reminder that all these experiences I don't want to have, all the parts of me I don't like, all the things that I wish weren't happening, are all part of this one living experience I'm having while I'm here. And that's the pathway to realization, I think, anyway. It's the pathway to liberation, and that's the pathway to love. If I can love everything that's here, then maybe I can get a little bit of freedom. So I would wish as much love and freedom and acceptance as possible to all the family watching this and this human family that we're a part of. And thank you for having me.
Thank you, Dennis. Very beautifully said. Thank you to Kim, Dennis, and Kim. Thank you to Kim, Dennis, and Angelika for joining us for Volume 1. Just some quick housekeeping. Well, also, obviously, thank you for joining us. Always, your comments are inspiring, they're challenging, you're advocating for each other. So I always say, please go through the comments and look. Some people had some wonderful comments that I wish I could have read. There's also great links throughout. Also very, very important, next Wednesday at 7 p.m., same time, same channel, we'll be joined again by Kim, Dennis, and Angelika for part 2, or Volume 2 of Grief and Loss. who knows where it will go? But we'll be talking about grieving, what's coming in the future, and we'll touch on any and all questions you may have. I actually think we got to most of our questions this evening. Also on Thursday, we will be having volume 2 of Scrupulosity at 7 p.m. next Thursday with Patrick McGrath and John Hirschfield. We had a really good time a month ago, and so we look forward to having that conversation again. As always, I want to thank the IOCDF and my partner behind the scenes, Fran, for managing behind the scenes. That was so beautifully eloquent. If you haven't already and you want to be notified about all the programming the IOCDF is having over the next month, definitely be sure to subscribe and follow on Facebook, Instagram, YouTube, and Twitter. They are my secret powers. It's the only thing I can do. Can you imagine being an X-Men and that was the only thing you could do was post a graphic on Facebook? Like, I'm so powerful. Anyway, but we would love that. We would accept that. We would embrace that. We wouldn't imagine if we had another power, because that's not reality. So anyway, until next week, thank you for spending your Wednesday evening with us. As always, you can contact the foundation at info@iocdf.org. They're there to answer any and all questions. Also, please visit the website at iocdf.org. If you have questions, you want to research anything that we've talked about, there's amazing resources. Also, please visit peaceofmind.com, also amazing resource as well. We will also have links to Kim, Angelika, and Dennis where this will live. This video will live. So if you want to check them out, what they've written, their Instagram accounts, and everything like that, please feel free. So until then, until next week, have a wonderful night. Stay safe, stay vigilant, feel the feels. Don't let OCD off the hook. Embrace it. And this was amazing. Thank you guys so much. Have a good night.
Thank you
very much. Thanks.